Main risk factors for preventable chronic diseases are tobacco use, lack of physical activity, and excessive alcohol use. The risk factors have caused unpreventable and preventable diseases like disability and death. To reduce these risk factors, prevent diseases or injury before it ever occurs, reduce the impact of a disease or injury that has already occurred, soften the impact of an ongoing illness or injury that has lasting effects. We all need to invest our time and money in improving healthy lifestyle behaviors by increasing physical activity and improving our diet. By doing this, almost 35% of early deaths will be avoided. Our integrative nutrition health specialist, Betty Olayinka Folarin, aka BOFA, advocates for this every Sunday on Health Corner and Nutrition segments showing on Healthy Living with BOFA channel. Join us every Sunday, 2 p.m. US time, 7 p.m. UK and Nigerian time, 8 p.m. South African time. See you there.
Every human being needs to understand their pancreas. We need to know the size, what it looks like, and where it is in the body. The size of your pancreas is about 6 inches. That is about 15 centimeters long. And it looks something like a pear. Pancreas is hidden behind the stomach. It's an organ that releases hormones called secrets, including insulin, to help your body process sugar in the food you eat. And it produces digestive juices to help your body digest food and absorb nutrients. Today, we are educating on pancreatic cancer as one of the 12 preventable cancers we have been treating for the past 3 weeks. Let me tell you why you should try your best to prevent this type of cancer when we return from the break. This is Healthy Living with BOFA Talk Show. Thank you so much for joining us today. Let's take a quick break. I'll be right back.
Health is wealth. Vital is vital. You gotta take care of yourself.
Hello, do you want to live your best? You want to live your way into a healthy and beautiful body, free from all forms of diseases such as diabetes, high blood pressure, cancer, hemorrhoid, and so on? Are you limited to particular foods intake due to your health status? Oh yeah, I bring to you good news, as you can eat what you want. Contact us today for any of these services. Holistic nutrition consulting based on individual health status such as diabetes, high cholesterol, high blood pressure, among others. Visit us in our office at 10039 Bisonet Street, Suite 228D, Houston, Texas, with zip code 77036. You can as well book an appointment with us on our website www.begandbomservices.com or call 347-61 35485 347-61 35485. At B&B, your health matters to us.
Health is wealth. Vital is vital. You gotta take care of yourself.
Our topic today is very critical because this type of cancer is the most dangerous type of cancer you should try your best to prevent from growing in your body, in your pancreas. So let's jump right into full discussion. Pancreatic cancer, as it is known as a silent killer, is a deadly disease. It's a deadly disease that affects the organ behind the stomach that helps digest food and produce hormones. Do you know why it's called silent killer? It is a silent killer because it's hard to detect and diagnose because it often causes no symptoms until it spreads to other organs. You see how dangerous that is? You don't see symptoms at all until it progresses to the point of spreading to other organs. That is the most dangerous part of it. Any disease that shows no sign is dangerous to the body. Of course, disease is dangerous, but it's more dangerous to the body. Pancreatic cancer is also hard to treat because it is usually resistant to chemotherapy and radiation. Yes, it is resistant to chemo and radiation. And of course, surgery is only possible for a small percentage of patients who have localized tumors. So the prognosis for pancreatic cancer is very poor, with a 5-year survival rate of only about 10%. The main risk factors for this deadly disease called pancreatic cancer are, number one, smoking. You need to be very careful if you smoke. Obesity is another factor. You need to lose weight. Diabetes, if you are a diabetic patient, you need to be careful because it has to do with insulin. Yes. If you have chronic pancreatitis, you are at risk. And of course, family history. If your brother, your sister, your father, your mother, your aunt, your great-grandmother have this thing, there is possibility that you too have pancreatic cancer. So that is what I mean by family history. That means it's generic. Yes. Now, what causes this deadly disease called pancreatic cancer? Let's talk about the causes. Maybe when we have idea of the causes, we will be more careful. Yes, I think so. If you know this can cause this, you prevent this. So let's talk about the causes. It is not clear what causes pancreatic cancer. However, doctors have identified some factors that may increase the risk of this type of cancer. And this includes smoking, like I mentioned earlier. Smoking and having certain inherited gene mutations can cause this pancreatic cancer. So people that smoke, they are more at risk of this pancreatic cancer. Yes, compared to other people who have no lifestyle of smoking. Now, other risk factors are diabetes, chronic inflammation of the pancreas, family history of genetic syndromes that can increase cancer risk, including BRCA2 gene mutation and Lynch syndrome, old age. A large study demonstrated that the combination of smoking, long-standing diabetes, and a poor diet increases the risk of pancreatic cancer beyond the risk of any one of these factors alone. Now, what are the complications? Yes, complications. As pancreatic cancer progresses, it can cause complications such as, number one, weight loss, jaundice, such as yellow skin and eyes, dark color urine, and pale colored stools when your feces is pale. That's what we mean by jaundice. Pain can also be complication. What type of pain? A growing tumor may press on nerves in your abdomen. And when that happens, it causes pain. And that pain can be severe. It can become severe, very, very severe. So that is the pain I'm talking about. When the tumor, the growing tumor, the pancreas, press down on your nerves in your abdomen. Because remember, your pancreas is behind your stomach. So when the cancer is growing and it presses down the nerves in your abdomen, it causes pain. And that pain can become severe if it happens. Next is bowel obstruction. What is bowel obstruction? Bowel obstruction can block the flow of digestion. Yes. It can block the flow of digested food from your stomach into your intestines. Now, let's take a look at the signs and symptoms. Like I said earlier, signs and symptoms of pancreatic cancer often do not occur until the disease is advanced, until the patient is about to die. That's the way I can put it. And this may include abdominal pain. It's not that you will not have symptoms, but it doesn't happen like every other cancer. Like when you have breast cancer now, you have lumps maybe a year before. This is not. Pancreatic cancer is not like that. Maybe 3 months before the person dies. That's when you start having symptoms like abdominal pain that radiates to your back, loss of appetite, or unintended weight loss. When you begin to lose appetite, you don't eat, you don't feel hungry. When you start losing weight, unusual weight loss, you are eating, yet you are losing weight. Another one is yellowing of your skin and the white of your eyes. That is jaundice. When you begin to have jaundice, it can happen to your stool, your feces, can happen to your urine, can happen to your eyes. That is another sign. And this happened a few months again. Light color stool, dark colors urine, itchy skin, new diagnosis of diabetes or existing diabetes that is becoming more difficult to control is the sign. When you have diabetes, or the one you have before, or when you have the new, when they just diagnose that you have diabetes, or you have it before, existing one, you have it before, but it's becoming more difficult to control. Doctor cannot control it. You cannot control it. That is a sign of pancreatic cancer because it has to do with your insulin. Next is blood clots. Yes, and last one is fatigue. These are the signs you begin to see when this disease progresses. Yes. When it's gone to the advanced stage, about maybe stage 4 or stage 5, that's when you start seeing all these signs. When it cannot be treated, when it cannot be controlled, when it cannot be prevented, that's when you start seeing all these symptoms. Let me tell you today. I said it in I always say it. It is not about how wealthy you are. Because if your wealth, the money you have in the bank account can give you good health, I don't think anyone should get sick. I don't think those people out there that claim to be wealthy should have any health condition, should have one single underlying health condition. I don't think so. Steve Jobs died of pancreatic cancer. Are you telling me that Steve Jobs have no money? Has no money to treat that cancer? But because he's a silent killer type, he's a pancreatic cancer, he started seeing these symptoms after between 3 to 6 months. That is what I'm saying. Health is wealth. Not wealth is health. Not at all. Now, if signs and symptoms do not occur until the disease advances, when should we see a doctor then? For you to know that, maybe something is happening to your pancreas. When do you see the doctor? You don't want to wait. You need to see your doctor if you experience any unexplained symptoms that worry you. Many other conditions can also cause these symptoms. So your doctor can tell you, can check you for this condition as well as for pancreatic cancer. So all these conditions I'm going to tell you, I just mentioned, could be for another disease. But when you see your doctor will be able to tell you if it is for pancreatic cancer or for another problem, another health problem. But if you don't see your doctor, how will you know There's no way you can know. And that is where prevention comes in. We must be preventing all these things from happening at all. And that is what I mean by taking preventive measure all the time to reduce the risk of this cancer, not only pancreatic cancer, all the diseases. Yes. First thing you want to do to prevent it is you want to stop smoking if you smoke. And if you smoke, try to stop it. And if you don't know how to stop, talk to your doctor about some strategies that can help you stop. You can't do it alone. It is hard to stop smoking, stop drinking. You need help of professionals who can help you. That is why you need to speak to your doctor about strategies they can give you to go about it. Next is maintaining a healthy weight. You don't just gain unnecessarily. You need to keep fit. So maintain your weight. Next is choosing a healthy diet. That's the key word right there. A diet full of colorful fruits and vegetables and whole grain may help reduce your risk of cancer. Not only pancreatic cancer, all cancers. And lastly, you need to consider meeting with a generic counselor if you have a family history of pancreatic cancer. This is very important. Of course, I used to tell people that if you have history of any of this cancer, I had many friends that died of cancer. And when you look at their history, it's like the brother has, the sister has, the mother has, the father, just like that. Then I said to them, I said, you can prevent this thing. I don't believe in generic problem. No, I don't. If my mother died of high blood pressure, I know what causes high blood pressure. I know, and I've heard people saying it, that this can prevent, you need to stop doing this, you need to stop doing that. I'll continue doing the same thing. I'll stop smoking. I'll stop drinking. I will control my weight. I will eat healthy. Trust me, you will prevent it. You will fall into the category of dark history. I'm telling you. It's because your mother, your father, your great-grandfather could not get all this information before they died of this disease. Nobody was telling them what to do to prevent it, what to eat. Nobody was telling them that. Now you have the opportunity to get the information you need to prevent it. That is what I'm talking about. You can prevent it now. You don't sit down and be telling people that, oh, in my family, cancer is a family disease. Excuse me, says who? You carry cancer cell. Your father carry cancer cell. Everybody in your family carry cancer cell. And so what? What makes it history? What makes it generic? How it grows depends on what you eat and what you do to that body. And don't forget that your body is different from your father's body, your mother's body. How they treat their body is different. What they eat is different. So if you eat healthy, you will not die. You will not be at risk of that. If you maintain your weight, if your mother couldn't, if you can, then you will not be at risk. That is just it. It's just a common sense. If you can adopt it, you will skate through. You will not be a victim. Because I don't believe in, oh, it's a generic. My family have it, my mother. No. I won't be a victim of bad history. I will break the genes. I will make record. Like, you know what? This is my own tree, family tree. Only me, my husband, and my children. And none of them will have the history of my fathers, my mother, my great. No. That is what you should stand for. I don't believe in generic problem. Generics. No, I don't want to hear it. So please and please, I'm saying this because we need this education. We need this information. And if we can do it, if we can take the steps and prevent it. If we can take preventive measure, I don't think we should be in and out of the hospital. I believe we should have the optimal health we all deserve. Trust me, this is what I can do. This is all I can do to help, to bring the information to your awareness. Yes, it is your responsibility to believe it, digest it, and make it work for you. I've done my part. Do your part and prevent it. Let me stop here so that I can come back next week with more tips on health and nutrition. I'm Dr. Betty. Good night. Have a productive week. Bye.